Hello everyone, my name is Jason Russell. I'm a student physical therapist assistant at Jefferson State, and today I'm going to be talking about paracentesis. So before I begin, paracentesis is a procedure and not a disease. So as I go forward into this PowerPoint, I'm going to be referring to the abdomen and how it relates to this specific procedure. So to begin, paracentesis is the removal of fluid from a normally hollow body cavity, for example, the abdomen. So common signs and symptoms include bloating, inability to pass gas or stool, abdominal pain, and shortness of breath. Now the shortness of breath is due to the pressure exerted onto the diaphragm from the fluid. And this pressure exerted will not allow a patient to take deep inhalations or deep breaths. So when a doctor or healthcare provider is testing for this fluid buildup, they will use one of two techniques. The first one is called percussion tapping, where a doctor will place their hand on the suspected area of fluid buildup, and with the other, tap the dorsal side or the back of their hand and listen for a specific sound. Now this sound will give them one of two clues. One, the presence of a fluid buildup, and two, how much fluid has possibly already built up. And the second way is through an ultrasound. And an ultrasound will give a doctor or healthcare provider visual confirmation on a fluid buildup. Once they have this confirmation, the doctor or healthcare provider will choose where they want to begin the procedure. And when they're deciding where, they're taking into the account which area has the most fluid buildup. And this is going to give them the greatest amount of space to insert the needle. If they insert too far, they risk piercing, stabbing, or tearing anything important, like the digestive organs, or not inserting deep enough and not withdrawing the correct fluids. So a large amount of space involves the lowest risk. In the case of a small amount of fluid, a needle with a syringe is inserted after iodine has been applied and sterilization has occurred. With the needle and syringe, a small amount of fluid can be manually drawn out to remove it. In the case of a large amount of fluid, a needle and catheter are inserted. This allows the fluid to be removed over a long period of time and be emptied into containers that are properly labeled, which will then be tested to find the underlying cause of the fluid buildup. Again, paracentesis is a procedure and not a disease. So, doctors and healthcare providers are trying to find what is causing the fluid buildup. Now, in most cases, again, the fluid is tested to determine why the fluid has been built up. If it is a recurring thing, there is no need to test it because the reason is already known. But in most cases also, once the fluid has been removed, an IV will be attached to replenish the fluid that was removed to prevent the patient from going into shock. And that is my conclusion on paracentesis and the removal of fluid from a normally hollow body cavity. Thank you guys so much for listening, and I hope you have a wonderful rest of the day.